This is Dr. Kavya Malani for Virginia Medical Updates. In this series of programs, we want to bring to the community the latest evidence in the field of medicine. As you know, in general, medical knowledge is always changing. There's a joke that says that the questions on the national boards are always the same in medicine, but the answers keep changing, which means that we're faced with the same questions, except for medical knowledge advances and answers do change. So in general, in this series of programs, we will be bringing together experts from the community and experts in the understanding of medical literature. And we'll try to get together and create a meeting of the minds between the informed consumer of medicine, the patient, and the experts, and the medical evidence. So bringing these three elements together, we should have an interaction and a discussion and a discourse on the best practices in medicine, which basically allows us to have a medical system where the doctors are the most informed, the patient informed, and basically the most cost-effective and proven evidence-based interventions are implemented for the wellness of the patients. The overall idea is this, that in general, medical evidence keeps changing. And doctors sometimes practice out of sync with the latest medical information and the latest medical knowledge. And this is a thing that has been studied and proven. In general, for example, it is known that doctors prescribe antihypertensive medications to treat blood pressure based on their decade of graduation from the medical school. So that's important. So in this set of programs, what we want to accomplish is to create an evidence-based knowledge resource for the community. And we are open to a dialogue. It's not a one-way dialogue or one-way presentation, but we do have a Facebook page, a Twitter account, and we do want to have interaction with the community and want to learn from each other and move this dialogue forward. We look forward to hearing from you at Virginia Medical Updates, and where we will try to bring it together experts in the field and the latest medical evidence and the informed patient, the informed consumer of the medical enterprise. And I look forward to having this discussion with you on a regular basis and meeting you in social media and also in person. Thank you.
Welcome to Virginia Medical Updates. Thank you for joining us today. My name is Alejandra Gonsalves, and our topic for today is cardiovascular disease risks and prevention. Today we have with us our very own Dr. Madhu Henry. Dr. Henry has 14 years of experience as a primary care physician. She studied at George Washington University. And thank you, Dr. Henry, for joining us today.
Thank you, Alejandra. I'm going to start with a quote. One of the first duties of the physician is to educate the masses not to take medicine. Soap and water and common sense are the best disinfectants, by William Osler.
I like that. Making sure that patients have some common sense and keeping it simple with soap and water is a great thing for patients who are, not worried about all the medical terms that you have to think about. But tell us, how is it that you are so interested in this topic that we're discussing today, the cardiovascular disease?
My interest in cardiovascular disease is because it's preventable, and a lot of the basis of prevention is education.
Okay, so if you're saying it's preventable, then what is it that we could do as patients to not get this disease?
Sure. Cardiovascular disease, the most common causes, the common risks are all areas that we have choice in: diet, exercise, weight, alcohol consumption, smoking. These are all preventable, and with the proper education and the proper relationship, areas that we could modify.
Of course, yes. Mm-hmm. Yeah, so if it's something, I know that it's very pervasive in the United States, cardiovascular disease, and it may be that maybe we're just lacking what it is that causes it. Do you have
Sure.
more information on that you can elaborate on?
Sure. Actually, since 1975, cardiovascular disease has still been a leading cause of death and disability within the United States. I think that the best place to start when you kind of open the discussion is a definition. Cardiovascular disease is defined by coronary heart disease, stroke, and peripheral artery disease. Coronary heart disease is, in layman's terms, a heart attack, an MI. It's a blood clot or an aneurysm in the heart.
Okay.
A stroke is, in medical terms, a CVA, cerebral vascular event, or a transient ischemic attack. But for patients, that's a stroke or a aneurysm in the brain. And peripheral artery disease is the same thing. It's a blood clot down in the leg or in the lung, so it's in an organ.
Okay, so essentially cardiovascular disease is a blood clot either in your heart, your brain, or somewhere else in your body.
Exactly. That's
Okay.
the simplest way to look at it. The other thing that's important to think about this is, unlike in television or in the movies, people don't survive these events. You know, a heart attack, you die. A stroke, there's usually a devastating consequence. There can be a paralysis or a life-changing event. So my passion comes from the idea that it's preventable. We can do things to change the outcome.
Right. And I know that the American Heart Association is big on trying to educate people on the prevention, and they have a big push that they have, or a big campaign that they have with the red dress for women. Is there any difference for women when they present with heart attack symptoms?
Yes, absolutely. And that's, again, a quote that really, I think, augments or highlights what you're saying. The most common way women present with heart disease is dead on arrival. And it shows that in most cases, women aren't even aware they have cardiovascular disease. So it is really important to take this specific patient population and educate them further about how they do present.
And so for women then, if it is such an issue with the heart health, are there different symptoms that they may present with versus men for a heart attack that we should know about?
Absolutely. I think it's very commonly known when you think about a heart attack, you think about tightness,
right, your
chest
arm
pain and pressure, exactly, your left arm pain and jaw pain. But when you talk to women, and we do studies and we look back at how they were feeling possibly months prior to presentation, the top symptoms that come forward are pain or ache in the upper back, jaw or neck, shortness of breath. Many women will present with flu-like symptoms, nausea, vomiting, cold sweats, a feeling of anxiety, a loss of appetite or discomfort, general discomfort. Many times upper abdominal pain, epigastric pain. It could be mistaken for reflux or heartburn, very common.
So many different symptoms that we could have, and really it just shows the importance of having a great relationship with the doctor and making sure that you have these discussions and making your appointments if you're not feeling well.
Absolutely. I think I highlight the idea that at the annual exam or preventative screening exams, many of these questions are brought to light, especially when we are dealing with the different patient populations, focusing on these types of questions and expanding or elaborating on it at that time. The other one I wanted to mention, because we did talk about stroke, is there's an acronym out there to kind of help patients recognize and to act fast.
Okay, great.
And that's exactly, the acronym is FAST.
FAST, okay.
It's to recognize a stroke. We use the F for face to see if there's any facial drooping or a smile that seems like it's asymmetrical. A for arms, does one arm drift or fall downwards? S for speech, is there any unrecognizable, garbled, slurry speech? And T for timing, if these are seen, we ask that family members act very quickly, very fast, and call 911. These are signs of a stroke.
Okay. Yeah, I think that's really important. Probably something that we should all be aware of, not just within the family, even at work. You could help one of your coworkers, getting them to the ER in a timely fashion to help them out.
Exactly.
But I know you said that this is a preventable disease and talk to us about what can be done a little bit more in order to avoid having this.
Sure. So there was this very big study called done by Inner Heart. It studied 52 countries around the world, and it showed, after taking into account all these risk factors, that there were 9 modifiable risk factors seen in 90% of first-time heart attacks. I mean, that's unbelievable, actually, if you think about it.
That's a lot of chances to be
Yeah.
able to stop the
intervene.
disease.
Exactly.
Yes.
So I just wanted to highlight them, and then we could take some time and maybe explore upon them.
Okay.
But diet, smoking, hypertension, dyslipidemia or cholesterol management, physical inactivity, obesity, diabetes, which is in many cases considered actually a cardiovascular event, heavy alcohol use, and psychological or psychosocial factors. This is kind of the first time where stress has been brought forth with the medical community and acknowledged and recognized as something that could lead to a heart attack. And I think most commonly in my practice, I'll have patients come in and claim they're under a lot of stress. Could that lead to a heart attack, doc? And I've heard over the course of training and years, oh, no, no, no. But now we've actually shown through studies, we've proven it, that yes, stress does lead to the different events that can lead to a heart attack.
And so these 9 factors, this is something, as we discussed before, that during the annual physical exam you would touch on with the patient while they're in your office.
Exactly. I think that in a screening, annual physical and so forth, we're doing both a history where we're able to factor in the patient's complaints, their family and genetics, their social history where we talk about smoking and alcohol consumption. And we're also given that opportunity to forge a relationship and kind of stick in here. Here's some areas where you could make some changes. We also take blood work, so we are looking at things like cholesterol and diabetes and so forth.
That's really important, I think, spending the time and making sure that patients get in there annually to make sure that even if they're not feeling like they have those symptoms, that maybe they just don't know
Exactly.
that it's a back pain, as you mentioned, or upper abdominal pain, and it could lead to having the disease.
Right.
So is it something that has been, like you said, the diet is so important that patients would be able to make that change?
Sure. And I thought now would be a good time to kind of focus on diet, since I gave you a list of 9, and that's a lot to talk about in one occasion or one sitting. But focusing on diet is something that not just the medical community, the community wide has started to focus on. The amount of availability of different grocery stores, the more vitamins and nutrition therapy that's out there. Even our colleagues and counterparts like chiropractors and naturalists have come into this area of trying to attack cardiovascular disease with education through a healthy diet. We have many studies to prove that diet can truly make a difference.
So it seems, Dr. Henry, that these 9 points are something, as we discussed earlier with the physical exam. Would you be touching on those points during that time with the patient?
Absolutely. We screen for these issues and make recommendations based upon modifiable risks. I like to simplify this by presenting it in a concept similar to smoking, alcohol, inadequate physical activity can all lead to obesity, while dyslipidemia, hypertension, and diabetes can all be managed in some extent by diet. The potential benefits for the primary prevention strategies have been hypothesized in many different studies and have been proven. There's a large study by a Nurses Health, it's called the Nurses Health Study, and it studied 120,000 female medical providers, and it showed an 84% risk reduction in women who observed dietary changes. They did not smoke and they did not drink alcohol for 20 years.
Wow.
84% risk reduction.
That's
And then-
really big.
Yeah, and then there was a women's health study that similarly studied 40,000 women and showed It was a shorter course of period of time, but they showed a 2.5% risk reduction in the first cardiac event. So very large and compelling reasons to take diet on.
Right. Okay.
So to that, I would say a healthy diet, what we've kind of as summarized as a point would be that fruits and vegetables compose the primary bulk of your diet. Fibers, including cereals, foods with a low glycemic index or low glycemic load. And what this means is there are foods out there that raise or spike blood sugar. The body does better with soluble fibers or foods that don't contribute to this. So in old world medicine, we used to call that the starches or carbohydrates. Nowadays, we have started to get a little more sophisticated in the way the nutritionists and, like I mentioned earlier, grocery stores advertise this. But to simplify it, it's your stock vegetables, things like broccoli, Brussels sprouts, cauliflower, grains, quinoa, oatmeal.
So those are the healthy things that we should be looking for.
Exactly. They don't seem to have that high glycemic index. In addition, we started to do many studies and again, consumer-driven changes to avoid to continue to eat monosaturated fats and to avoid trans fatty acids or saturated fats. And again, this is the omega fatty acids, which are seen in fish and nuts, avocado, plant sources, and supplements.
Okay. Okay, great. So it seems as if we should lean more towards fruits and vegetables, try to not have as much meat and dairy, and exercise. I know you mentioned staying active is really important. So thank you again, Dr. Henry, for being with us today.
Thank you, Alejandra. It was my pleasure. I truly enjoyed the discussion, and I look forward to continuing it in the future.
Yes, hopefully we'll have you back again soon. And thank you everyone for joining us today. This has been Virginia Medical Updates. My name's Alejandra Gonsalves, and we hope to see you again soon.
Hello, this is Dr. Kavian Milani with Virginia Medical Update. As you know, there is a particular challenge in our daily life in the modern society as to how to achieve happiness and how to have a positive approach to life and how to try to put aside negativity or even neutrality, because positive thinking and positive brains obviously do have an advantage in terms of how well people do. Traditionally, people thought that they should work hard and work harder and achieve, and then they will be happy. Well, modern psychology and modern theorists have actually challenged this age-old myth. The new thinking is different. At this point, the leading theorists believe that actually this is reversed, meaning that people that are positive and people that are happy are able to achieve more. And it's not that success and happiness follow each other, but it is that happy people become successful and are able to achieve and are able to do more. In general, the modern society is set up that, for example, a person who goes to school or goes to college and works hard and gets a degree and then basically will try to have a professional life, for example, and then will be happy. The modern theorists, again, have refashioned this old thinking. In the modern way of doing things, the idea is that happiness is the pivot and happiness is the basis for success in other phases of life. One of the leading books in this way of thinking is a book called The Happiness Advantage by Shawn Achor. And I will take the next few minutes to introduce this book. This book was written by Professor Shawn Achor of Harvard University. The Happiness Advantage is the result of his work with Harvard University students for 10 years, looking at things that create success in these highly achieving students. It turns out that, in general, a school like Harvard attracts some of the best young minds in the country. And when these kids go there, obviously, before that, they were in the top 1% of any school that they were at. And now all of a sudden, about half of them are below the median line. So what makes a difference in terms of who is able to achieve more and who can be more successful at such a highly competitive institution? Dr. Sean Aker has studied this issue at length, and one of the most popular courses at Harvard University is the course that he teaches called the Happiness Course. It turns out that success really depends on a happy and an achieving mindset. We all live in a world that is basically, in a sense, rush. We're rushing from event to event, from appointment to appointment, from class to class, from point A to point B. And the result is that we live in a highly stressed environment. The Happiness Advantage is a really remarkable book, and I believe it will revolutionize the way psychology is practiced and the way people can begin to help themselves, in a sense that it really begins to reorganize the way we think about modern life. And the things that the book brings out are amazing. There are multiple studies that it will be very inaccessible to most of the readership of the book, yet over years he has managed to accumulate all these studies. What is the role of meditation? What is the role of yoga? What is the role of exercise? What is the role of reading? What is, for example, a way to break out of bad habits and create new habits? How can we actually change our social reality from a negative one to a positive one? How can we begin to rewire the way we think about things and to begin to see things in a positive way that does by itself lead to more success and to more happiness? I've enjoyed the book a lot, and it is my #1 recommended book at this point for the audience, for the people who want to begin to make better sense of how to transition themselves from a negative way of thinking to a more positive way of thinking. Thank you.
Hi, my name is Dante Davis. Welcome to Virginia Medical Updates and our first fitness session. Today we will go over numerous things as far as workouts that you guys can use right at your own home. We will focus on lower body strength, upper body strength, and abs in your core. So we want to start off first with our lower body strength. We want to start off with a set of body squats, which are sets of 20, 15, 10, and 5. And we're going to hold after each set. So at 20, we hold it down for a 5 count. 15, we hold it down for a 5 count. 10, hold it down for a 5 count, and 5. Here we go. Keep it going. 12, 13, 14, 15, 5 more, 19. Hold at the bottom. 1, 2, 3, 4, and 5. And we're going to continue that rotation with 15 reps, hold for 5 seconds, 10 reps, hold for 5 seconds, and 5 reps and hold for 5 seconds. Our next workout, we're going to do lunges and to a high knee. Make sure you guys, we're going to do 3 sets of 8. Really focus on pushing through your heel that's on your front leg and bringing the opposite knee up high. Here we go. We're going to go now. Start back, up, 1, up, 2, up, 3, push through the heel, 4, bring the opposite leg up high, and keep it moving. 7, 1 more, 8. Now we're going to switch legs. 3 sets of 8. So first we're going to do squats to the squat holds, and then we're going to do 3 sets of 8 of the lunges, and we're going to keep it going and keep it moving, building that lower body strength. Now we're moving on to upper body strength. We're going to do something I like to call side push-ups. 3 sets of 8 of this also. Here we go. On me. Right, middle, left, middle. 1, right, middle, left, middle, 2. Let's go. 1. Down, 3. Over, over, down, 4. Over, over, down, 5, keep it going. Down, 6, over, working your shoulders. Down, 7, your pecs, and your triceps. There we go. Side push-ups, 3 sets of 8. Promise you, they'll build up your shoulders, your triceps, and your pec muscles to increase that upper body strength. Last movement for upper body that we have is what I like to call angle push-ups. So, quick demonstration. We will be here, right arm back, then back to middle. Push up. Left arm back, then back to middle, push up. All right, 3 sets of 8. Let's work, let's go. Push up. Back, push up. Back, push up. Back, push up. Keep it going. Work the shoulders. Like I said before, great shoulder burn and chest burn and pec burn. There we go. Upper body strength with the side push-ups and the angle push-ups, 3 sets of 8, and you guys can increase that upper body strength in no time. Now we're moving on to our core. We're gonna focus on lower core and your upper core. Going to show you guys a couple movements. Focusing on the upper core, we're going to reach for our toes, as so, and we're going to do 3 sets of 20. All right, let's go. Reach for your toes. 1, 2, 3, 4, 5, 6. Keep your legs straight. 8, 9, 10. Keep going. 11, 12, 13, 14. Try to touch the toes. 16, 17. Keep the core tight. 19, 20. Good job, good job. 3 sets of 20 of that, and I know you'll feel the burn in that upper core in those ab areas. Now, to work the lower core, we're gonna focus on the same exact movement, but we're gonna spread our legs. Same thing, 3 sets of 20, and make sure you guys are burning that fat. All right, here we go. Legs spread, and we're gonna reach low in between to work the lower abs. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Reach all the way through. 12, 13, 14, 15. Try to squeeze it at the top. 17, 18, 19, 20. Now you can always use in all of these exercises, lower body, upper body, and core for a full day of working out. Thanks for tuning in with Virginia Medical Updates. I'm Dante Davis, and this is our first fitness session.